Can I share something with you? There's one treatment in my office that has dramatically changed the lives of my female patients, and it doesn't involve surgery. Make sure you stay to the end of this video and I will share an extra bonus benefit of this treatment that nobody really talks about. Hi everyone, my name is Dr. Degha Fongod. I'm a board certified physician practicing aesthetic medicine in the Northern Virginia area, and I help women preserve their natural beauty without surgery. So I had a patient come into the office for a consultation with a complaint of urine leakage. She's a mom in her 40s and she's had 4 children, and she had all her kids through vaginal birth. She told me that after her second treatment, she started to notice that she was leaking small amounts of urine whenever she coughed or jumped or sneezed or laughed, but it didn't really bother her too much. However, after her third pregnancy, she started to have worsening of these symptoms to the point where she was actually using pads daily. When this happened, she started to avoid going to the gym with her friends, and then that led to her gaining weight, which further worsened her self-esteem. She has had a decrease in sensation and pleasure during intimacy with her spouse. And when she shared her concerns with her spouse, unfortunately, he blamed her for it. She wanted to know if there was a treatment in the office that could help her gain her confidence back. 50 million women in the United States suffer from urine leakage due to stress urinary incontinence. And stress urinary incontinence is a symptom of vaginal laxity. So what causes vaginal laxity? We're going to talk about 5 things that contribute or cause vaginal laxity. So during childbirth, our vaginal wall goes through a lot of trauma to get your baby out, right? And obviously babies are big, so the process of getting a baby out of the vaginal wall during birth is going to stretch the vaginal wall or the vaginal canal significantly. Now, if you have multiple births, then you're going to go through this trauma or this stretching multiple times. And as you get older, naturally your vaginal wall is not going to be as robust because you have decreased elasticity and decreased collagen as you get older. So not only is vaginal birth going to complicate things, but having vaginal births as you get older further worsens the problem. On top of that, if you have children that are big, they tend to put a lot of pressure on your bladder, and that can lead to urine leakage as well. And we'll talk a little bit about that. The second cause of vaginal laxity is advancing age. So again, like I stated before, as you get older, you tend to have a decrease in collagen in your skin, and that also leads to decreased elasticity. We see this with our face, where we start to notice drooping in our face, and our skin is just not as taut as it was before when we were younger, and this happens with age. So the same thing that happens with our skin, the collagen and the elasticity in the skin decreases as you get older, same thing happens in the vaginal wall. Now, the third reason why you could have this symptom is because of menopause. And with menopause, this is more of a hormonal component. So you have a decrease in estrogen, and a decrease in estrogen, again, is going to further decrease collagen and elasticity in the vaginal wall. But on top of that, it also causes a decrease in lubrication as well. So a lot of times people or women who are going through menopause will experience vaginal dryness, and that can cause a lot of discomfort during intimacy as well. The fourth cause of vaginal laxity is actually frequent sexual activity, and that can get complicated with the use of sex toys that might be a little bit bigger than usual, or activities such as fisting. Those things are not usually typical for the vaginal wall. Again, they can stretch the vaginal wall more than is typical, and so that can lead to vaginal laxity. Okay. And the last thing, and it's not something that people think about a lot, but when you significantly lose weight, you can also end up having vaginal laxity because, again, you're losing the elasticity in the vaginal wall with significant weight loss. So those are the five reasons that can cause or contribute to vaginal laxity. So our patient was experiencing two major symptoms related to vaginal laxity. The first symptom she was experiencing was urine leakage caused by stress urinary incontinence. Now, stress urinary incontinence is basically going to be caused by two things. First of all, you have an increase in abdominal pressure, and that happens with activities such as jumping, laughing, coughing, sneezing. The other thing that's going to happen is you're going to have a weakened pelvic floor. So with aging and with vaginal birth, our pelvic floor tends to get weaker. And we know that we're supposed to do Kegel exercises to help strengthen our pelvic wall. Well, not everyone knows how to do Kegel exercises. Not everyone is diligent about doing them. And so if you have a weakened pelvic floor and then you increase your abdominal pressure, the result is going to be you leaking some urine. Now, an interesting group of people who don't fit this build, who also deal with urine leakage, are young female athletes. And the reason for this is, again, like we said, they increase their abdominal pressure. So let's say they're doing activities such as CrossFit or lifting significant amounts of weight, and they put so much pressure on their abdominal wall that they can end up having urine leakage. So this is an instance where a woman is having urine leakage, but she's never had children, she's not old, she hasn't lost weight, none of the reasons that we mentioned before, but she's still experiencing urine leakage because she's doing an activity or an exercise that's increasing the abdominal pressure and as a result leading to urine leakage. The second thing that this patient was complaining about was a loss of sensation and pleasure during intimacy. And again, this is another side effect of vaginal laxity. I had a doctor friend tell me about one of her patients that had this issue, and her patient described it as throwing a hot dog down a hallway, because during intimacy she did not have any sensation, and as a result she didn't feel any pleasure, and you can imagine what kind of toll that could take on a relationship. The symptoms of vaginal laxity can have a huge impact on a woman's mental health. Imagine being embarrassed to work out because you don't want to leak urine during your workouts. Or the woman could be avoiding intimacy with her spouse because she might be experiencing vaginal queefing. These symptoms can lead to loss of self-esteem and confidence. And unfortunately, it can lead to patients avoiding activities that they once loved. This can also lead to problems with intimacy with their significant other. So what is the solution that I had for this patient? Well, the treatment that I had for this patient is the Vaviv treatment that we have here in the office. It's a laser that puts out radio frequency waves that heat up the tissue in the vaginal wall. And that heat is going to lead to changes in the vaginal wall. That leads to production of collagen. This is going to lead to vaginal tightening. It's going to stop urine leakage. It's going to increase lubrication in patients who may be postmenopausal. And for that extra bonus I mentioned, it's going to increase orgasms during intimacy. I mean, who doesn't want that, right? It's a single treatment that is safe and painless. It takes 45 minutes and there's no downtime, and the results last more than a year. So let me ask you a question. Can this treatment help you? Imagine being able to work out with your friends again without having to worry about urine leakage. Imagine what it would be like to finally be able to go to a trampoline park with your kids and not have to worry at all. Wouldn't that be amazing? Let me help you get your comfort and confidence back. Book a consultation with me and let's see if this treatment is the right option for you. And make sure you share this video with someone you know who might be dealing with the same issues that this particular patient was dealing with. I will put my contact information below. I hope this video was helpful. Please like the video, share it with a friend, and subscribe to the channel for more videos. I look forward to seeing you on the next video. Bye!